Ladies and gentlemen, we're here again with Memphis Light, Gas, and Water Committee. We have one item, a resolution approving the option to renew the contract with Kimco for the first two 12-month renewal terms for fluorosilicic acid in the amount of $609,000. Madam Wardlaw, will you call the roll, please?
Chairman Fluoride.
Here.
Vice Chairman Lowry.
Here.
Councilmember Boyd.
Yes.
Conrad.
And Councilman Brown and one Councilwoman Halbert are here.
I am Yvonne Madlock. I'm Director of Shelby County Health Department, and I do have with me Dr. Leslie Gordon, who is the Chief of Dentistry at the Health Department. He obviously will have more technical information than I have and could answer technical questions. I will attempt to just be very, very brief, quite honestly. I would remind this body and the community that fluoridation of water is a long-standing practice in the United States, and it's been evidenced by, been supported by a significant body of research that demonstrates both its effectiveness in preventing dental caries, both in children and adults. It has been safe and efficacious, and also very, very cost-effective. It is cost-effective in its relatively low cost per person, particularly in large urban environments where you've got the cost spread over many people and many ratepayers, so to speak. And at the same time, it is cost-effective in the amount of dollars that it saves all of us and each of us in terms of dental bills and the cost of dental care. Fluoridation was first introduced into public water supplies beginning sometime after the 1930s, well tested throughout the 1940s, and by 1962, 1970 was pretty much the norm in many environments. By 1999, 144 million Americans were covered by water supplies that provided fluoridation, whether naturally occurring or introduced as we have here in Memphis and in this particular region. As a consequence, dental cavities, both in adults and in children, has been reduced. You may or may not be aware that back during World War I and World War II in ancient history, it seems at this point, many people were rejected from military service because of the extent to which dental caries had reduced the amount of teeth that people still had in their heads and that adults had. By the turn of the 20th century, 21st century, that was certainly not the case by any means. The Centers of Disease Control in 1999 recognized the 10 top public health victories throughout the 20th century. And in that top 10 was fluoridation of the water supplies because of what it means in terms of reducing dental caries.
All right, thank you so very much.